Hi, everybody. We are going to answer your top 5 questions we get all the time about medical care while we are traveling. Stay tuned. Hi there. We're Chris and Steve from Eat, Walk, Learn. We're an early retired couple who left our corporate America jobs in May of 2021. We sold everything, including our home in Denver, Colorado, and all the things in it, plus our cars, just so that we could travel the world full time. Everything that was left we put into our 2 carry-on suitcases so we can travel lightly around the world. Would you please take a moment to subscribe and like? We share our tips from our Nomad life, take repositioning cruises to get from continent to continent, and we enjoy gorgeous hikes in beautiful places around the world. We also try to eat vegan as often as we can. We hope you'll enjoy reading one of our latest books, including 50 Hikes in 50 States, or our bestseller, 2 Carry-Ons and a Plan. You can pick them up on Amazon next time you're there. Please follow us on social so you can join us every Sunday at 5 p.m. Eastern. Thank you so much for sharing our adventure with us. Where are we?
We are somewhere in the middle of the Pacific Ocean. We're on a cruise right now on our way back to Seattle, USA, leaving from Japan. And we're really excited to be answering your questions that we have from our viewers about our health care and about things like medical insurance and prescriptions and things like that. And we're going to kind of do a little bit of like question and answer with each other so that we can share with you our experiences. We certainly don't know everything, but we can tell you about our experiences in traveling around the world for the past 2 years on how we've handled some of these issues.
And we're not doctors and we're not giving medical advice. We're just sharing our experience. And all these questions came from all of you in your comments. So why don't we start with question number 1?
Yeah. So question number 1 is that we get this really almost every week. Somebody asks us about health insurance. I know that's a big topic. It really hasn't been an issue for me because I haven't had to use my health insurance, but we do have insurance. So, Chris, tell our viewers about how we handle health insurance.
So we have medical insurance, just like you have in the States where you hopefully have in the States where your employer provides it, or you have the affordable health care or whatever. We have that as well. So we have medical care through IMG Global, and we have a traveling medical policy which covers us everywhere in the world except the U.S., Singapore, Taiwan, and an island in the Pacific or something. Yeah. And when we go to those countries, we just pick up a little traveling insurance plan. But it's catastrophic care. We have a $5,000 deductible. And we really just carry it in case one of us gets hit by a bus or has a heart attack or or gets diagnosed with cancer or something catastrophic. We have used it, though. When I had knee surgery, I did file a claim and did get some money back, surprisingly, from IMG Global. So I was very happy to have that. Now, our medical insurance is different than travel insurance. A lot of people will get travel insurance which covers usually lost baggage, missed flights, expenses incurred when you have a travel disruption. We don't have travel insurance. We get that covered usually through our credit cards, but medical insurance is not travel insurance. So a lot of times people who have travel insurance have medical insurance at home. We don't have medical insurance at home. We have a traveling medical insurance policy from IMG Global. Does that answer the question on medical care?
I think that answers the questions. And just, personally for me, I haven't used my health insurance strictly because as we've needed health care around the world, it's just so much more affordable. And I don't have that mentality anymore that I can't just like walk into a doctor's office unless I have my insurance card, or otherwise it's gonna cost a lot of money. It hasn't cost a lot of money. A good example is I went to a dermatologist in Split, and we'll talk about that when I talk about prescriptions a little bit more. But I think that it was $50, I think, for a complete exam in that case. And so you're not. I just the idea,
the mentality of you have to have insurance
right.
to see a doctor it doesn't exist as we've been traveling around the world.
Exactly.
I forgot to mention that our medical insurance costs us about $200 a month combined, so about $2,400 a year for our medical insurance.
Yeah, and it's a great peace of mind. Again, knowing that if something really bad happens, we've got insurance to help us out and help us take care of those events. So when we have had to go to the hospital, Chris had a hospital event with her knee. Tell us about that.
Yeah, so the hospitals often were better than the hospitals that we've been to in the US. The staff always spoke English. The interactions were fine. I had no issues. I never felt like I was in some strange medical, unsafe, risky situation. The hospitals were top notch, first level, high grade, modern, and clean. So no concerns at all with going into using medical offices and hospitals around the world so far.
Yeah.
Okay.
And that was a particular example where we were in Kuala Lumpur, and we were there specifically for medical care, and a great city for that. And again, it takes a little bit of research when if you know that there's going to be a medical event or something that you want to take care of, going to a place where you'll be taken care of as well or even better than the care in the United States. So this is another question that comes up, which is, how do you do that research? How do you know you're going to a place, you're going to be in a place where you'll be taken care of?
So I think in the States, if you don't know a provider, you might go onto your medical insurance website and search for a provider. Same thing happens for us. Our IMG Global has a provider a provider location service. We go there. I also will go to Facebook and go into maybe one of the expat communities for the city or something that we're in, ask for recommendations for a doctor, and then I'll also just Google and look at recommendation list or reviews of different doctors and so on. Then I get that narrowed down to 3 or 4 different doctors, and then go to their websites or their hospital websites, do a little research, maybe ask in the expat groups if they know about this particular doctor, and look at their credentials, and then call and make an appointment. And I might even call and talk to the office or the hospital a little bit more about their doctors or tell them what I'm looking for. So just like you would do in the US, same thing here as you travel, you just use different tools that are located to the particular location that you're going to. So it has not, we found dentists all over. Dentists are really easy to find. My knee doctor I found in the Split Expat Croatia group. I had another knee doctor in Mexico that I found in a Puerto Vallarta expat group. So it's fairly easy. So next question.
I mean, it's amazing about the things being digital. Mm-hmm. Why don't you ask me about continuity of care?
We're not good actors, are we, Eddie? Next question. We get asked this a lot, and that is, how do you have continuity of care? How do you make sure one doctor knows what the other doctor needs to know and share information among the doctors? How do you do that, Steve?
Yes. Well, so for me, personally, I hear people saying, I've got my doctor in the U.S. that I've been going to, every year or whatever for the last 42 years, and I can't, I need to.
She knows me like the back of her hand.
Yeah. I really don't have that experience. I've had good quality care in the United States, but I can't tell you that I have a particular person or a particular, physician office that I went to regularly and depended on, for my life. Anyways,
some people do have that.
Some people do have that, and the way I can respond to that is that having your records being digitized is incredibly important. And this is something that we've been able to do as we've been traveling around, is to be able to have, for example, when was your last physical and what was your blood tests and information that you can have with you that is readily available, that you can share with other doctors and you can share them with each other. So we both had examples with X-rays, we from dental X-rays, and Chris with MRI and X-rays, that we were able to take that with us and share that with the other doctors that we went to, so that they can actually see that information. And again, if you're going to a good quality doctor, not only are they going to recognize that, but they're going to be doing their own evaluations and their own analysis as well. So a couple examples for me. One is that I had let's talk about prescriptions specifically. I had a prescription that I needed to get refilled, and I needed to see a dermatologist for this particular prescription in Split, Croatia. I did the kind of research that Chris was talking about, asking people and doing my own research. Found a dermatologist who didn't speak a lot of English, but she really was a great doctor, and she did a complete evaluation. I told you it cost about $50. I needed a prescription refilled, and she recommended something that was, it turns out, better than what I had that prescribed for me in the United States. So it's taking care of my condition, completely, no issues at all.
Yeah, you look 29 now.
I know, it's like a completely new face. Anyways, that's not it. So, and she explained to me that what I had been prescribed and what I had been using for like the past 4 years was really kind of an invasive prescription and something that should not be used long term. So, just the fact that I was able to get great advice and great care in Split, Croatia, I'm really happy about that. And I found out that this is something that that's readily available around the world. It's like I'll have no problem. The drug, yeah, is. I'll have no problem finding it over the counter in most cases, or very inexpensively, very easily everywhere in the world. So really happy about that. The other example with prescriptions is, for one, before I left the United States, I was really nervous about this. I had about a 7-month supply because I didn't want to leave and I didn't want to have to worry about it. But again, my worries were really unfounded because we had our health screening in Kuala Lumpur, and had the test results. Really, Chris will talk more about that, but. I asked my doctor when I did the health screening in Kuala Lumpur about my prescription, and I had a picture of it. So I think that's also really important too, is take a picture of your prescriptions that you can share with pharmacists, that you can share with other doctors. He looked at it, immediately knew what it was, immediately was able to prescribe that to me. Super readily available, about a third of the price here or in Kuala Lumpur than it was in the United States with insurance. So this was without insurance. It was still a third of the price. Very easy to take my prescription into the pharmacy, filled immediately with no problem. So I know different people, because we've had questions that you've got very specific prescriptions, things that you really care about and you really want to make sure that they're available around the world. It's easy to do that kind of research and find out if those drugs are available. And also know that they may not be called what they're called in the United States. We have this simple example with Tylenol. There's no Tylenol in Europe. A lot of people know that. And it's not even called, you can't even search for like acetaminophen, which is like the chemical. The chemical. It's what is it,
Proseconol?
Proseconol or something like that. Anyways, the exact same drug. And it's.
I mean, that's an over-the-counter example, but those examples exist all through prescriptions. Right. But I think the point we're trying to make here is, if you have a prescription, there's kind of a 3-prong process you can go through. You can find another doctor as you travel to rewrite your prescription. You can go into a pharmacy to see if they'll fill it with the current prescription that you have, or you might find it over the counter and there's not even a prescription that's required. So I think the fear of having the challenge of filling prescriptions, it's a valid fear. We had it, but we quickly found out it's an easily solved problem that just takes a little bit of, a few minutes on Google or a few minutes of researching, and you get the problem solved pretty quickly. We also found out that pharmacies around the world are often a little bit more therapeutic and prescriptive than some of the pharmacies in the U.S. I found in the pharmacies in the U.S., if you go to the doctor and you say, it hurts here, they'll say, go to the doctor and come back. Sometimes here in the pharmacies around the world, you say it hurts here, and they go, oh, take this. So it's a little bit different philosophy too, as well. Pharmacies are a little bit more helpful. Pharmacists are a little bit more helpful, I think.
But why don't you add a little bit more about the continuity of care question, and specifically with our health screening versus physical.
Yeah. So if you followed along about my knee story, the knee story starts in Mexico, where I had an MRI. Then it goes to Kuala Lumpur, Split, where I had X-rays, and then in Kuala Lumpur, where I ended up having surgery. And in all those cases, I just carried my records with me. I had a link for the MRI, I had a CD for the X-rays, and the doctor just looked them up. And then, so it was just, it'd be like if you're in the States and you go to the hospital and they say, go down to the street to the lab to get your work done. and then bring it back. It was the same thing. There's no difference. It's just there's countries in between. And then with
2,000
the
miles.
and then with the medical records, I think a lot of people get kind of hung up or concerned that the medical records are in English. So there's two ways to solve that problem. One is just throw your records into Google Translate and they will translate for them. I had my first knee records from Mexico were in Spanish, and I translated them into English, and then I translated them into Malaysian, which was unnecessary actually because the doctor spoke English. But that was really easy. And then if you look at like your blood work or your typical lab records, most of the things on there, especially for blood work and cholesterol type things, are in their Latin terms, and those Latin terms are the same around the world. So like bilirubin and what's white blood, leukocyte, and all those words that we kind of put common words on in English, they're just the same words in the other countries too. So not a big deal with dealing with records in general. Or if you need to, you can certainly hire a translator. They're readily available. You can go to Fiverr.com and hire a translator and get a medical translator, and they will translate them into the language of need and put some sort of certification on them if necessary, and you just pay a small fee for that. So the last thing I think we wanted to talk about was vaccines. And we're not talking about COVID vaccines, although we got our COVID vaccine, our booster in Split, and then
Croatia, yeah.
did we get one in England or something, or Ireland, or anyway? We can look at our COVID card and tell you. But no problem getting our COVID vaccines. But in relation to the traveling vaccine, so this is like typhoid, yellow fever, Hep A, Hep B, Japanese encephalitis, those types of things. What have we discovered about vaccines? Traveling vaccines.
Well, again, we have discovered that those are available in many, in clinics and hospitals around the world. They get vaccines everywhere. Mm-hmm. And one of the things, especially for me, is when I had my health screening done and I had a full blood panel done, is that they tested for one of the things that was Hep A and Hep B. And it came back that it was not evident, so that the vaccine was the antibodies. I don't know the technical details of that, but it showed as if I had never received those vaccines, which was really good news for me, because that's important, and I wanted to get those. So we were able to within a few days be able to schedule an appointment to come back and get those vaccines taken care of. In fact, I think we actually have one more round.
Yeah, we have one more round
that's coming up
or something. But they're really affordable. So in the U.S., before we left, I think your medical insurance with your employer allowed us to get some of our travel vaccines. But they've either expired or they need boosters as we've been traveling. So I actually had gotten yellow fever in South America, which is good for 10 years, and I paid a lot of money for it at the time. It was about $200 for yellow fever. But in Kuala Lumpur, we got typhoid, Hep A, and Hep B, and they were very affordable. I think the typhoid was $30, I think it was. I don't remember now, but I just remember the prices being much, much, much less than in the U.S. I know a lot of medical insurance in the U.S. will cover some travel vaccines, but some of it won't. So, like if you're no longer employed, I mean, your employer might do them, but maybe not your family or something. So, Anyway. Don't worry about if you're worried about the cost of getting your vaccines before you leave the States and you're going to be traveling for long term. Maybe make a plan that one of the first things you do when you arrive in country is go get your vaccines in country, and they will be much cheaper than if you got them in the U.S. and as effective. So, I think the takeaway I want to give today, besides subscribing,
if you haven't subscribed yet, please give us a thumbs up and subscribe. We appreciate you being here.
Yeah, thank you. I think my big takeaway as you've been traveling around the world is there's doctors around the world, people get sick around the world, and every country has its own CDC or FDA or USDA or whatever the governing body is for their medicines and their doctors and their vaccines. And they're educated too, and they're looking at science as well, and they're coming up with recommendations and safety guidelines around their drugs and their pharmaceuticals, just like we do in the U.S. and they're taking care of us too. So I no longer worry anymore about our medical care or our health care as we travel, because it's easy, it's affordable, and we are, knock on wood, we are staying healthy and vibrant and well.
We are.
Yeah. So if you have questions about medical care, don't ask us, I got a red spot on my toe. What do I need to do with it? If you are trying to figure out how to get your medical coverage or you have questions that we didn't cover, ask them below. We'll be glad to answer them when we get off the ship. We'll be right back in Seattle. Talk to you later.